AFMC is really known.
That this video will provide ideas
And also make sure
between the office hours.
Thank you for joining us for this episode of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Stacey George. And Stacey, you are the AFMC Practice Transformation in Partnerships and Colorectal Cancer Screenings in Arkansas.
Yes, ma'am. That's
Thank
correct.
you so much for joining us.
Well, thank you for having me. I'm really excited to be here.
Me too. You're doing really important work. And so I'm excited to talk about that today. So first up, tell me about the screening rate, the colorectal screening rate in Arkansas.
Sure. So first I want to tell you about nationally where we're at. So the Centers for Disease Control actually report that nationally we're at 74%, actually 74.3%. And looking at those same statistics, same time period, Arkansas is not that far behind. We're actually at 71%. However, recently there were some changes made to the guidelines, and I know we'll get to that here in a few minutes. But those guidelines show that in Arkansas, according to the American Cancer Society, we are behind at even 57% for 45 to above. So the first statistics I gave you were for age 50 and above, 71%. So in Arkansas, we're at 57%. So we definitely have a discrepancy there overall. But also in our counties, in our Delta region, we have even lower rates than our statewide statistics. So there's a lot of improvement that can be done with colorectal cancer screening in our state.
And so you mentioned that the screening guidelines have changed. What are they now?
Yes, so back in 2021, the United States Preventive Services Task Force actually updated the recommendations. So previously it was ages 50 to 75 were recommended to be screened for colorectal cancer. However, in 2021, they dropped that age range down to 45 because we are seeing a lot more patients, younger and younger, diagnosed with colorectal cancer screening. And there's a lot of reasons for that, but we are seeing them earlier and earlier.
And what are the best screening methods for that?
There's lots of ways to be screened. First, there is an at-home test that you can actually pick up at your doctor's office. It's called an FOBT or a FIT test. That's the ones most commonly we use in Arkansas. And the doctor prescribes it or orders the test, sends the kit home with the patient. They do the sample at home and then they bring it back. Another stool-based test is called the Cologuard, which a lot of our patients are familiar with because it's advertised on TV all the time. That's where the doctor orders it. It's mailed to the patient's home. The patient collects their sample, and then it's mailed back in the box that's provided. And then the other one that we most commonly use in Arkansas is the actual direct visualization test. It's the colonoscopy. So we hear that a lot in clinics. It used to be considered the gold standard. It's what our providers prefer, obviously, for their patients to do because it is a more invasive test. But we have a lot of patients who push back on it. But you ask what's the best test. The best test is whichever test the patient will complete. So they need to be given their options. And that's a big important thing is we need to make sure our patients and our providers know it is the patient's choice. They need to have a say in what screening method they're willing to do because any test is better than no test at all.
So you mentioned that any test is better than none at all.
Yes.
But what are the difference? What is the main difference between a stool-based test versus the direct visualization method?
Sure. So stool-based tests don't require a prep most of the time. So you can have your normal diet, you can have your normal routine, you don't miss any work for it, it's done in the privacy of your own home. So there's lots of advantages to a stool-based test. You have to do those more frequently though. So most stool-based tests have to be repeated once a year, and the Cologuard is every 3 years. But the direct visualization or that colonoscopy requires a prep. So there's a bowel prep. There's something usually they have to drink or take to cleanse their bowel. So a lot of times they have to take off a day of work before it to do the prep itself. Then they have the test. And then there's even some areas in the state, some pockets in the state, where the provider actually makes the patient come back for a third visit to get their results. So a lot of patients in our state can't afford to take off 3 days for a test or 2 days for a test to do the prep and the test themselves. So that's the biggest difference between them.
And UAMS has been awarded a grant from the Centers for Disease Control. What kind of partners are you looking for?
Sure. So Thankfully, UAMS won the grant, and they decided to partner with us at AFMC and our practice transformation team. And we have started in year 1 with a healthcare system that has 6 primary care sites. Year 2, we brought in another healthcare system that has 2, now 3 primary care sites, and we are looking for another one. We're about to start year 4, and we are looking for partners that have a colorectal cancer screening rate currently below 50%. So that's kind of our cutoff. It's above 50. We're not partnering right now because we have pockets that are lower than that. So a clinic that has less than 50% colorectal cancer screening rate, but who's ready to do some things to change to get their rate up. It's going to be some hard work as far as it requires us doing some testing cycle changes, updating policies and procedures, getting providers on board. Providers are our key. If we can get our providers on board and understand the importance of talking about it, any clinic can be successful.
And you're signing up new clinics?
We are, yes. We're about to start year 4, as I said, and year 4 starts in July, and we are looking for a couple of new healthcare systems to bring on with either 1 or 2 clinics. It doesn't matter. It doesn't have to be a healthcare system with 6. It could be a smaller healthcare system that has 1 or 2 locations that's willing to come in and start working with us.
And how does that affect rural areas of the state?
So colorectal cancer screening is more prevalent and has a higher mortality rate in many of our counties. And I'm going to read one of my note cards I brought just because I want to make sure that you understand how many counties in Arkansas are affected by this. And like I mentioned earlier, we have red counties. That means they have a higher mortality rate, higher incidence and mortality rate, and also a higher late stage diagnosis rate. So we didn't catch it early enough. So we have more mortality because of that. So if you give me just a second, I want to flip over to this because I want to tell you these counties because, like I said, they are along the Delta. You're going to recognize many of these counties. So we have Lawrence, Jackson, Poinsett, Cross, Crittenden, St. Francis, Monroe, Prairie, Arkansas, Jefferson, Drew, Little River, Dallas, Ouachita, Union, and Calhoun. All of those are red counties in Arkansas. So that shows you the impact in our state and how much work there is to be done to get those red counties to turn to yellow, to put them at a little bit lower risk.
So what do you want our healthcare providers to know? How can they get involved? What are the steps that they need to do? Sure. So to get involved, we're going to share a website on the screen, which is our Partnerships in Colorectal Cancer in Arkansas website. There's also going to be information of how to contact me and Mary Beth Curtis. So you can reach out to either one of us if you are interested in partnering with us for this 5-year cycle. We do know that CDC is actually going to put out another grant when this one ends, and hopefully we'll be able to work on it as well to have additional partnerships. But any additional information you want, you can reach out to either one of us. But I do have some facts that I'd like to share. And these are from the Fight Colorectal Cancer website. And I want to just share these kind of as a way to close, to tell you about the impact and kind of where we are and where we're going as far as colorectal cancer in our nation. Of all cancers, colorectal cancer will take the most lives of people under 50 by 2030. 1 in 23 men and 1 in 25 women will be diagnosed with colorectal cancer in their lifetime. Those with a family history of CRC are at higher risk and need to be screened earlier than 45. The LGBTQ plus community is carrying a disproportionate cancer burden. People with the lowest socioeconomic status are 40% more likely to be diagnosed with colorectal cancer than those in the highest socioeconomic status. 1 in 3 adults, 45 to 75 years old, are not getting screened as recommended. Colorectal cancer incidence and mortality rates are not uniform across race and ethnicity. But to end on a positive note, there are more than 1.5 million colorectal cancer survivors in the United States. So I think that's the important thing about what we're doing. We want people to know that it is preventable to some degree because it's based a lot on what you eat and about your health and your risk factors. It's treatable, but also it's beatable. And so that's what I want to close with is, even though we have staggering statistics of where we're going, we have 1.5 million survivors in our states. Detection is key.
That's
So
exactly
important.
right. That's exactly right.
So how do community providers and healthcare providers connect with you?
Okay, so that's sending out an email to myself or Mary Beth Curtis with UAMS. We've given our information. You'll be able to share that. And also we have a website that you can actually go out and look at things that we've done. You can look at some of our graphs that we have, some pictures that our staffs are having fun with their toilet paper cakes and our slogans. You'll be able to track all of that online. We also share things on Facebook, and you'll be able to see things through the UAMS Facebook page.
Okay. Stacey, thank you. Thank you so much. Such important work for the state of Arkansas and for the whole country that affects almost everyone that you meet.
That's right. Absolutely. Thank you for having me. We're happy to come out and talk about our work. We're really excited about the great things that are going on in Arkansas.
Me too. Thank you. And that's it for this edition of AFMC TV. Have a great day, and thanks for watching.